All right, folks, welcome back to this episode of the REBT Advocates with Dr. Michael R. Adelstein and myself, Tommy Bateman. Now, today we wanted to talk about a response to another listener and watcher. I'm assuming she, because lady's in the name, but she wrote that in asking the question, is there any limits to this REBT thing that you speak so highly of? Is it the best thing ever? We think it is, but is there ever a time that REBT is contraindicated or not appropriate, or what are the limits? So, Michael, why don't you get us started on that? Are there any limits to REBT? When do you not use it?
Okay, well, I think that's a great question. And I think there are a number of limits or limitations. And first one that comes to mind is with someone who is schizophrenic, hearing voices, and really not able to, or bipolar, and which means they're either in a very, very depressed mood or in a manic mood, so their thinking is all over the place, and they're unable to focus on the session. Now, I've worked with people with this diagnosis of schizophrenic and bipolar, but they've been on medication that stabilized them somewhat, so they could speak reasonably well and we could communicate. And in those cases, REBT has been helpful. Well, with schizophrenia, I don't think you can expect a cure, but you certainly can help people be less anxious about their hallucinations. For example, I had a client who thought the KBG was following him and he was very anxious. And then when he got the idea, mainly through writing out 3-minute exercises, the A, B, C, D, E, F, that even if they are following him, it's not awful, it's not the end of the world, that he's survived this all these years and he'll survive it in the future. And he was conscientious in writing those 3-minute exercises out, then his anxiety diminished.
Yeah.
Although he still had the hallucination or that paranoid idea.
And the thing is, I mean, even with psychotic disorders like schizophrenia, I mean, delusions are pretty hard to break, even with medications. However, just because they have a delusion or some sort of hallucination, auditory, hearing voices, or seeing things, doesn't mean that they can't think rationally about what they are experiencing. And that gives us a kind of a buy-in to, let's think rationally about what's happening to you, or what things that this internal stimuli that's happening to you. Let's reframe what we think about that. So Michael's example is perfect. There's a delusion about the KGB. Well, let's just say it's true. Do we have to have the emotional upset because of that? So perfect example.
Right. Yeah. Exactly. Very good. Another types of cases that come to mind is working with children or mentally retarded people. And I've helped both children and mentally retarded people. With children down as young as 10 or 11 that I've worked with personally, we worked with a more watered down version of REBT. So we didn't get so abstract, but we helped identify thoughts like, it's the end of the world if my mother criticizes me.
Yes.
So we worked on, it's not the end of the world goes on, and it's just her thoughts, and that doesn't change you. You're still the same person you were before. And same with mentally retarded people. I've worked with 1 or 2 mentally retarded individuals and with the same idea, just making it very simple. But I've worked indirectly with much younger children, 2, 3, or 4-year-olds, through their parents, where I instructed their parents to give their young children rational messages, such as, you spilled the water, but you're not a bad person. Or it's not the end of the world that this bad thing happened. And even with young children like 2 years old, hearing the message over and over again, hearing these messages helps them get used to it, and then as they get older, start thinking about it and maybe even internalizing it at that young age.
So, and these aren't necessarily limitations, or because the thing is, REBT remains true. That beliefs lead to emotional consequences remains true regardless of the client's cognitive ability or physical limitations, such as having bipolar disorder, which is a medical issue needing medical treatment, or schizophrenia, which is a brain medical issue requiring medical intervention, medications. So these are kind of working within these medical confines. So yeah, if what I say a limit of REBT is things that are better treated by physical intervention, such as medications and surgery. REBT can't do that, but it can certainly work within those physical limitations and cognitive limitations to come to some truth. In the case of people with low IQ, still repeating, yeah, it's not the end of the world if this happens, and maybe the idea helps lead to a better emotional outcome. So it's not really a limitation to me, Michael. It's kind of still there.
Yeah, yeah, that's true. That's a good perspective on it. Another limitation, or perhaps you can show how it's not, is when I have clients who don't do the homework, because one of the things we emphasize in REBT is that insight is not enough, unless if you have an insight into a better perspective and a better way of looking at things, unless you practice it and reinforce it and go over it again and again and again and again, as long as what you keep going over is meaningful, is not meaningful. But if it's meaningful, then that's what it normally takes to internalize it, get it into your brain, deeply feel it and believe it. So if a client doesn't do the homework, then usually it's not very effective. And I guess you could say this is a limitation of REBT, that it's not one trial learning. Maybe one day we'll figure out how to make it one trial learning, but it's usually not yet. Although I have had clients who, after one session or one lecture that I've given, or just reading my book, have said it's dramatically changed their life. So it's not a limitation under all circumstances for all people.
Well, it's just like any habit. I mean, the thoughts that lead to our emotional disturbance, anxiety, anger, the ones that we're trying to work on. I mean, they're habits of thought, just like any habit. It takes practice to break or to train yourself into new ones. So, yeah, of course. So, if you want to get stronger, you need to work out. If you want to, uh, um, have a healthy body, it would be better to eat well. It's just the same thing with emotional disturbance. If you would like a better emotional life, it would be better to think more rationally. So that's just what REBT prescribes. One of the times I don't use REBT is when I have a client that is not interested at all in changing. Of course, you wouldn't use any treatment modality at this point. REBT can't make somebody want to change. And we took on motivational interviewing many episodes ago, which is aimed at getting people from not wanting to change to wanting to change. But even then, our REBT is for those that want to do the work. And I'm hoping all these listeners here and watchers here are those type of people. So
Right,
the
right.
limitation on REBT is the limit on that particular limitation is a limitation on all therapies, physical, medical, all of them. So if you don't want to change, then this ain't going to work, but that's okay. That's up to
Right,
you.
right. Now, there are ways to persuade someone to change. I do
Sure.
get questions often from someone's spouse saying, how can I get my husband or wife to stop drinking? And one of the main ways is by telling them why you think it's a good reason that they change. And normally you think it's a good reason why they change is because it gives them their problem, gives them disadvantages, and in turn disadvantages you in the relationship. So if you explain that to them, that's one possibility of getting them more motivated.
So, Michael, see, that's the thing. I mean, I don't want to be, I don't know if Pollyannish is the right term for it, but this is why we practice REBT, because it's effective, it's multimodal. We can use it in many different substance use. With the psychotic disorders, we could use it there for helping those people with their emotional disturbance after they get medically treated. We could use it for couples, as Michael just said. We could use it for anxiety, depression. The sky's the limit with us. And of course, there's a unifying transferable principle that we can teach you as therapists and you can take into your life. So Why are we REBT advocates? Because the limitations, I mean, are limited themselves. So I thank you for commenting and asking the question, but it's evidence based, it's effective, it's philosophically sound. This is why we do it, folks. I think that's all I got to say on the matter.
Right, right. Well, that's a great way to conclude. And with your enthusiasm about REBT, as I am. So thanks for watching, and watch out for our next episode.